Preemies are different in a number of ways. Mostly their development has been altered by their premature birth. It's been shown that the brains develop in utero differently than they do after they're born, and so their brain development will be different, their lung development is different, their skin is different. There are just so many things that are having to function differently outside of the uterus than they do while they are in utero. There is no better incubator. Man has not designed an incubator that will work as well as the mother's womb. Dr. Heidi Alls has done a lot of research on the development of the brain and the different senses that are impacted and when they develop at the different gestations. And so if you expose that baby to things that the brain has not been developed to receive yet, it forever alters the way that brain is going to develop. Some of it, we try to compensate for. We try to keep them in a dark, a quiet environment. Loud sounds are obviously something we don't want to encourage, but conversely, it is so interesting to see the babies recognize the parents' voices and have them soothe when they hear a familiar voice. I think it's a positive stimulation, yes, to have a quiet, soothing, familiar voice, not the harsh, loud, clanging and banging and alarms that unfortunately are a part of that external foreign environment. Lungs is a huge one. Before 24 weeks gestation, the lungs lack the chemical surfactant, and that is part of what makes respiratory disease so prominent in this age group. So the development of the artificial surfactant has been one of the biggest keys to helping these little kids survive. Probably one of the most frustrating parts of our job is helping develop that feeding skill. Innately, the suck, swallow, breathe reflex develops somewhere around the 34th week. As parents, that is one of the most frustrating things, is seeing this baby that is breathing on his own, is doing all the things that a full-term baby should be doing, but just cannot get that eating skill down. They will, eventually. They all do. We don't have anybody that we've sent to kindergarten yet. The valley is never as deep as it was at first, but the progression is usually like this. Once in a while we get the exceptional superstar that just goes like that, and we're like, yay! The micro preemie needs so much external support. All of the machines and the bells and whistles, a lot of times they need respiratory support. They need feeding and fluid support. The multitude of lines to give them nutrition, to do lab work, for breathing, for temperature control, compared to the late preterm child who looks perfectly perfect and still may not be able to keep their temperature up, and so they need a little help in an incubator. So, they don't need so much with machines, they need more with just nurturing. And the other one needs nurturing too, but unfortunately they're not in a position for a lot of real hands-on nurturing. They need the technology that we have developed over these past 30 years.